All right, good afternoon, everyone. For those that met me this morning, Angela Gant Curtis, introducing myself again to you. And today I want to talk about the journey that I started 6 years ago that ultimately resulted in having the new OIT VA Innovation Unit. We interviewed several of our stakeholders around VA, and so these are some of the notable quotes, and some of these may resonate with you about there not being an innovation environment, it being chaotic, not having anyone to help you through the IT processes, which are many and they change often, not having anyone to support you with getting those things done, the lack of structure, employees not getting feedback, they submit an idea and it just goes into a black hole, and then IT being the office of no, right? So you've probably seen all of that. So before I go further to tell you about what we've done to solve for that, I'll tell you a little bit more about me. So for those that don't know, I actually started my career at the VA Medical Center in Atlanta. So I was a VHA employee, worked in fiscal, nursing service, accounts receivable, did a number of things. And I often wondered during my 12 years there, who was coming up with the ideas for what we get to do at the medical center, and who thought that they would work, right? Because often you're getting something that really doesn't work in real life. And so fast forward some 30 plus years later, you now have me that is your ally in OIT as a former VHA employee, and people still don't know I don't work for VHA. And I'm in central office, so I work every day to make sure that I'm the voice for you when you're not in the room and the voice for you when you're not at the table. In addition to that, with the organization that OIT actually built around me, right, because there wasn't one, to continue to do this work because they recognized you needed a partner there, I've been able to create processes and gate reviews where your ideas, when they surface, I get together with your national program offices, my colleagues in OHIL and Dean, my colleagues across OIT, and we determine what's the best path to help bring these to fruition, to do a pilot, a prototype, and then if they're successful, working with our new partners in DHO and those other offices to actually scale those within the agency. To do that, as I mentioned this morning for those that were around, we looked at making sure that there's always an environment in the cloud, either Microsoft Azure or Amazon's environment for you to actually pilot those solutions, right? So that you don't have to figure out where you can host it, and bringing money to do that, that's not necessary. So that was a game changer. We also wanted to make sure that that authority to operate that you hear so much about, that elusive 1 year or more process, that you don't have to go through that we have an environment that also has an ATO, so the barrier to entry to pilot a solution is there, right? You contact us, we make that happen. We also help with the conversations that need to happen with leadership and determining, do we continue to do more of this, right? And how do we pay for it strategically? Because as I mentioned, once you make your down payment, you still have to make the payments year over year to keep something going. And so I have the unique pleasure of being the one organization within OIT that's not risk averse. You're always going to get a yes, and this is how we're going to do it. Willing to make bets, as indicated here, and they may not always be successful, but what hurts in trying, right? And some of these ideas that have been implemented in the field and have been successful are making a difference in reducing some of the manual burden. Sometimes we decide that we shouldn't do it anymore, right? But we don't provide you another solution, right? I step into that gap and that void as well. An example of that, some of you may be familiar with, is the care management tool. You probably heard that it was going away, there was no resources, VHA was not going to support it anymore, OIT wasn't going to support it. But then someone found me, and of course my answer was yes, and this is how we're going to do it. So in a short period of time, we were able to successfully move it from where it was hosted, re-host it in the cloud, and provide the resources to keep it going no additional cost to anyone, using my current team that's in place and the cloud that I'm already paying for, right? And so now that we've done that, the next thing that will happen is someone will make us smarter about how you onboard new users, so a knowledge transfer, and we will open it up to other sites that haven't had the opportunity to use the Cure Management tool in the past, right? So these are the things that I do on your behalf because I know what it feels like to be on the front line and have someone saying, well, we're going to take this away, and you figure out how to do the work, but you still have to do it, right? So know that you have a friend in somewhat high places and that you can reach me anytime. Although I'm central, I'm always available to you. So I welcome you to take advantage of that, and let's continue to do more great work and innovations and moving the needle for not just our veterans, but for you as well. Thank you.